right, welcome to Business of Nigeria Leadership TV. This is a channel dedicated to our Business of Nigeria Leadership Institute, where we bring in dignitaries from across the world who have perspectives on leadership. And as Nigerians anywhere in the world, passionate about giving back to their country, you're going to see us come together to highlight our concerns about ways and manners in which things happen, bring our knowledge, experience, and perspectives to the table, hoping to help our youth understand how systems should work. So, joining me today, we have two very experienced and dignified individuals. I'm going to bring them on and allow us to talk about ourselves, myself included. So I want to welcome Dr. Hawa Dogonyaro and Honorable Maurice Ogunrobo Ovia. These are two distinguished Nigerians in Canada. I'll start by myself. My name is Khadija Haliru, currently serving as a municipal councillor. I'm a business owner, a coach, a trainer, and I'm here bringing to you the Business of Nigeria Leadership Institute as a way to inform and educate our youth on how systems of governance run and how things work, things should be. So welcome to the show. I want to start with Dr. Hawa. Can you tell us a little bit about yourself and what you do?
Thank you, Khadija. My name is Dr. Hawa Dogoyaro. I'm a professor, I'm a consultant, I'm also a coach and a mentor, and I work with different industries, both nationally and internationally, and I've been on different boards here in Canada and back home in Nigeria, and I'm really very pleased to be on the show.
Thank you. And Honorable?
My name is Honorable Maurice Ogunrobo. I was the former mayor of Ovia Southwest Local Government. Presently in Canada, I'm a Canadian Certified Human Resources Manager, and I work with Arena Foundation, and I'm also give support to healthcare support services.
Awesome. Welcome to the show, both of you. Today, we're going to be reflecting on some of the institutional failures that we have in Nigeria, and we're going to focus on the healthcare system. Recently, we have the story of Chimamanda Ngozi Adichie losing her 21-month-old baby to a system failure in Nigeria. And I think because of the high profile nature of this case, we've heard about it all over the world. And it just really shines a light on the suffering and the long-term problems that we have in our system. I am personally a victim of this. In the year 2000, I had a baby on April 1st, which was ironic. April 1st, 2000, I had a baby. And I lost that baby due to breathing issues. As a matter of fact, it was requested that that baby be transported from where I was in Ikeja all the way to Surulere without the proper equipment. And this child could not make it. So when you hear stories like hers, it really brings a lot of memories back for so many people. Recently, I've heard someone who lost her husband due to failures in the system, overdose of injections that are given to people at a time where it's supposed to be needed, but then it becomes the fatal error. So I just want us to talk a little bit more about, shedding light on how infrastructure without systems is basically what's failing us, because there's no shortage of governor here or, governor there boasting of building hospitals, having how many beds. And we have a lot of private people who've gone into this private healthcare industry. In fact, I would say we heavily rely on private healthcare, but we just really have to shed a light on how the healthcare system is still failing us, not because there are not enough hospitals, but because they're not focused on the systems, on the ethics, on the procedures that work for us. So let's see how we can maybe shed some light on what needs to change and how we can maybe move Nigeria forward in really taking the steps that they need to take seriously. So I'll just go to maybe Dr. Morris, Honorable Morris, on this. What's your take on this?
First, it's a very sad situation that one of our intellectual, was a victim of the situation. But you see, her case is one of so many. That's the truth. Like you said, it's just because of her societal status, and that's why her case is known. But there are lots and lots of, situations like that. It's just like when I was the mayor, you know, back home is referred to as chairman of the local government. So I've had the opportunity to work with people at the grassroots as a chief executive officer and as the authority of that environment. You find out that there are lots and lots of things that are lacking. First, the individuals themselves, the citizens themselves, are not true to themselves. They are not actually ready and committed, you know, for developmental process. It sounds as if it's funny. What's this man saying? The people prefer what you give to them personally to a collective benefits. Because I see no reason why you see health centers scattered around, but the personnel there are not willing to come to work. Who will you? So you, I mean, you are a citizen of a country, you work within that country, you are posted to the rural area. That is your job description, to be there in the health center where you can help the people within that vicinity to acquire, to get good health services. But these persons will not come to work. I take a practical example. You live in Benin. Ovia Southwest is about 45 minutes because it's about 45 kilometers from Benin. You prefer to stay in Benin to come to work in Ovia Southwest, right? Now, when there are emergency situations, who is there to assist these persons who need your services? So when I saw that, I felt so bad and I gave a marching order that any health worker, whether a nurse, whether a senior matron, whosoever the person is, must live within the environment where the person works. So if you do not put up structure that is very strict, because people bring sentiments into everything they are doing. But you see, what we have come to experience, and that's why I said to myself, God, if you give me the opportunity again, people will see and notice the great difference. Because for things to work well, the laws must be effected to the last. No,
Amazing.
but no, yeah, no matter who you are, you must face the consequence of whatever action you have taken, because you cannot put the life of the people, you know,
Interest.
yes, in a difficult situation. So, in the case of what we are trying to talk about, the Chiamanda's situation, I think I will look at it from the angle of negligence. You understand? And lack of commitment to the personnel who are there. Because
Mm.
I want to assume that as a professional, you should be able to know the steps to take when you are trying to administer medication or injection or what have you, the dosage
Mm.
and everything. So, but when you lack or when you play with it, it simply means that you have just shown negligence, and the consequence of that step you've taken should also be faced by you because
Yeah,
you are the
because
one
yeah,
implement that.
because when it comes to processes and procedure, this is where we
Yes.
see the failure in this case. Just getting to Dr. Hawa, what's your take on this? Because that was definitely procedural error on the part of that hospital.
Yes, I sincerely agree with Honorable. You know, the Nigerian government, they're always proud of oh, we have this number of hospitals, oh, we just opened a new hospital, we just started this, we just started that. That's not really what we're talking about here. We're talking about the staffing, the equipment, the drugs, the maintenance of these infrastructures. You know, I was also a victim of the healthcare system, the field system, basically, back in Nigeria some years back. I had ovarian cyst. I was really in pain. My brother took me to the hospital, and from my family doctor who like referred me to the naval hospital, said he gave us the name of a particular doctor. Getting there, luckily, the doctor was there. But guess what? He was on his phone. My brother went to him and said, "Oh, she's in pain. We referred to you. Please, can you attend to her?" He was like, "You know what? Just, just wait. Just wait." You see, I can't imagine a doctor seeing a patient in pain, and you want to be on your phone and say, "Oh, just wait." You know, I mean, you thank God I'm alive today to give the story. What would have happened those
Mm.
years back? And I will tell you that doctor will never admit to his negligence that, oh, you know what? I saw her, but I just ignored her. I just like, okay, let her wait for me and all that.
That
So
is
this is, and we see this, and this story I'm telling you, like, happened over 15 years ago. But we see it repeating itself over and over and over again. I have friends that have mentioned they lost their babies in the hospital due to negligence. They lost their loved ones, their spouses, their siblings, friends, and all that due to negligence. Oh, there was one that just came up in the news. I think sometime last week. A man lost his wife because they forgot the scissors in
scissors.
her when they had surgery for her. So, can you imagine situations like this? I mean, the negligence is getting absolutely too much and it's unacceptable. We're here in the Western world. This is not what happens in the healthcare here. They're not asking you about money, they're not asking you about your status. You get to the hospital, they attend to you first.
Yes.
Your health is more important, your life is more important to them than your status or your money or your health card or whatever it is you have to present. So why can't Nigeria adopt such vices that are there all over the world? And there's
That's
just
the
one
question.
more thing I need to just add to this is our most of our big shots, I would call them, never attend to their health cares in Nigeria. Why is the question?
Yeah.
That means they
That
know the system is failing our
yeah.
people,
So
right?
the thing is, when we talk about the procedural errors, like you just mentioned, the negligence, the expectation, even from our citizens, like Honorable mentioned, I find that what we have lacked all these years, and I sometimes give Nigeria credit for being just 60 years old. We're still going through growing pains. We haven't been left alone, really, to take a look at our inner problems because we've left our leaders to the privilege of traveling out and giving their services and never being those leaders who truly understand what's happening on the ground. Now, the failures that we are experiencing is because also we as citizens do not understand our rights. First of all, giving your example, going to the hospital and having a doctor sit on his phone while watching a patient, that would never happen here. Because, first of all, the doctor is not even exposed to the patient. He's expecting the nurse to hurry up and do their job and pass them on. So, when I take a look at the system failures, if the doctor maybe knows that you have to go through a certain step to get to him, then why is he even in plain sight of patients? Because that violates his duty to see a life in pain and rush to save that life. And at the same time, we have no processes in place to say quickly, how do we get enough information to the doctor so that they can truly save your life? And these are things that we know we're used to. You go to the hospital here, you go through triage. Everybody in Canada knows that that is the first thing you're going to, expect. You're not going to expect to get into the hospital and even see a doctor right away because you need to have your vitals and your things taken, and you need to have a spot in place. Then they basically choose based on the extent of your emergency to see a doctor. We don't have that. People just go in, and sometimes people can walk in and demand a doctor. So those are system failures. Those are also patient expectations. But because there's no clear rule, there's no fast and clear rule about it, nobody understands what to expect. And I think when we share our knowledge and experience with those that are in power or those that are even in private settings to know that this is what is needed. What is needed is we need to have a standard where when people come into the hospital, they expect that the nurse should take me, first of all, take my vitals, take everything, and see a doctor. And I know some hospitals do that. But unfortunately, when you get into the hospital, now we're talking about getting through the doctor and actually getting into surgery and seeing all that procedural nonsense happening along the way. Because just so that we're clear, what happened to Chinamada in this case is the fact that the child was already needing MRI. They took the child to the MRI station, and he was being restless. So then they decided to give the kid propofol or something, injection to soothe him, and overdose the child. that the child actually had cardiac arrest at some point. They may have noticed, but when they were taking him from one point to the other, he was limp, and there was no resuscitation, there was no first aid given. It was almost as if wanting to pass the buck to the next test that he was going to do. So nobody can tell now what happened in between the one test and be him taken to the next test. Meanwhile, they say he came on oxygen to the hospital. And then while you're doing the MRI, you take off the oxygen, but when he comes out and you're transporting him, you don't put back the oxygen. So I listened to the case and I just felt, for any doctor in the world who understands procedure, they were just heartbroken when they heard about this case, because and it's a matter of knowing your job, knowing the procedure, almost like a checklist. There's certain things that need to happen, even if it's before you get into the MRI, after you come out of the MRI, before you're transported as a sick patient. What happens when you get to a place where you need oxygen and you have to do testing? So many things that are, I think, simple for both nurses and doctors to understand, even for the layman to understand, that weren't done in this case. And so that's what makes this case really, really painful, and what makes us say we're wondering whether the buildings are just buildings or are they there to save our lives. Because what makes a hospital functional is the rules, the procedures, the emergency routine that they have to follow per department. Everybody doing their job that day would have saved this child's life. But sometimes we have the attitude of our people, again, that is the most important thing for any job, being the biggest obstacle in our Nigerian mindset. What do
Well,
you think about attitudes when it comes to our jobs and how we carry them out? Because some people just feel like, it's nurse's job now. Is the doctor didn't tell me now, or those kind of things where you went to school for your profession, you know what you're supposed to be doing, but people fail us all the time because of all these excuses. So what do you make of that? I'll go back to you, Honorable.
I just want to quickly say this that I've been opportune to be in a situation where I see the laws and I see documents. I'm telling you, it may beat your imagination that these laws are there, these procedures are there.
Hmm.
Nigeria is a country that has intellectual capacity. Translating this process into practical reality, that's where the situation is.
Mm-hmm.
Because sentiments, religion, so many factors comes to play. And that's where I would like to recommend a book called Afrocracy. It was a postulation by one Professor B.I.C. Ijoma, who tried to see some of the limitations between the Western world and the African perspective. And what he was saying is, before democracy came to existence in Africa, we have the Afrocracy, which is the government of the people within our locality. And that's why you find out that the Oba of Benin is in charge of the Benin Kingdom. The Emir of Zaria is in charge of Zazzau. The
Mm-hmm.
Emir of Kano is in charge of Kano. Now,
Mm-hmm.
even when the Western people came,
They could not.
they
Mm-hmm.
have to first of all go, do you understand me, meet out,
Yeah.
reach out to these people to strike a balance, a relationship, so that these persons can speak to their followers. So,
Mm-hmm.
so these things are already in existence. But unfortunately, they also they also they took that same kind of belief into the present modern situation, where if somebody is found guilty of a particular offense, the
Mm-hmm.
next person will come in and say it's because this person is not a Christian, that's why you want to do this. This person is not from the South, that's why you want to do this. So it begins to bring conflicting interests when it gets to development, procedures, and activities in Nigeria. Whether you like to take it or not, I'm telling you, sentiment is a very key factor that has limited the growth and development from in that country,
Mm-hmm.
because people bring in so many factors into it. But when we now have leaders who want to lead and they want to stand firmly on the right thing to be done, it's going to take some time, but we'll definitely get there. I give you an example. You see this case of healthcare, it is clear case of negligence. But if you want to take a serious step to deal with that situation, people will bring in sentiments.
Mm-hmm.
And it's a serious situation for us.
We are
So, and that's why I'm
definitely,
saying that we must put aside sentiment and be more practical in our approach.
yes.
Trainings, bringing qualified people, bringing dedicated individuals who are willing to create a good platform for transformation, because
Yeah.
this transformation will help in the overall benefit of the Nigerian people. But when
Yeah.
we begin to bring in sentiment, you know that this person is not qualified, but simply
Mm-hmm.
because you want a particular region to be represented in that scheme of whatever, you just create a space. You understand me? For that
Yeah.
person to come in so that they'll say that particular group or that particular region is represented in the process. They don't
Yeah.
look at the benefit, the overall benefit. They don't look at competence when it comes to this situation. I think
And
we
the
have to
people they put
change,
in. Yeah.
we have to change our perspective. You understand
Yeah.
me? And that's where citizenship, leadership, and good governance are the key three factors that can help to transform Nigeria.
Definitely,
If
which is why
you have, if
we're talking about it. We're bringing this up so that we can educate and inform. And I want to give Dr. Hawa a chance to reflect on that. She's talking the human impact, the trust, and basically we just talked about, what do we do regarding all that.
Okay, you know, I'm gonna kind of connect it to education. Let's
Hmm.
start from who are the uh, professors or the lecturers or the teachers of these doctors and nurses, because everything you're being taught in school, your whole ethic starts from school. So what kind of training are they giving them? What kind of exposure are they giving these medical students? That when they come out, are they supposed to be better than when they went into school, or worse than when they came out, when they went into school? So, I have a, it's a very funny story. I have an in law that actually went to medical school. And I tell you, she wasn't doing well in medical school. But today, to cut the long story short, she's a doctor. So, how did that happen? Look, everybody is not cut out to be a doctor. Everybody is not cut out to be a nurse. There's so many other things, radiologist, the lab chemist, and all that. There's so many other science courses. If you're not doing well as a doctor or as a nurse and all that, why don't you just find your passion somewhere else? Biochemist, whatever it could be, pharmacist. There's so many of them. So the whole thing now boils down to the human resource, and that's why you see these doctors and nurses, the negligence keeps building, because they probably feel just like you said. I mean, they were trying to pass Chimamanda's baby from one person to the other, because nobody wants to take the fault, nobody wants to take the blame. You know, God just saved me, because my last baby I had in Nigeria, she came out, she wasn't breathing, and they needed to put on oxygen. I mean, that oxygen was needed. But do you know they transported this baby from the labor room where I was to upstairs into the theater, because they didn't have oxygen where I was, where I delivered. So there's so many things, that there's so many lapses around. And just like a honorable said, we seem to think about culture, citizenship, and a lot of things like that. Because you find that in Nigeria, as a Westerner, you can't school in the north, or as a Southerner, you can't go to the west. As a Northerner, you can't go to the south. Like, why? Why are we doing that?
I think
Education
that
is
that has happened over the yeah that has
Yes,
happened
it
over
should
the
be open
years.
to everyone, wherever you want to go to school,
Mhm.
wherever your choice is, you should be able to go there and learn. You are there to learn, so that when you come out, you'll be a better person. So
Yeah,
the human resource is really very important. The kind of people we breed,
definitely
the kind of
agree.
people that come out from school are really very important.
Amazing. I think we've definitely hammered on this whole impact and trust and the education, the negligence, everything has to do with the trust that people deserve to have in our healthcare system. At the end of the day, accountability should exist after a hospital is commissioned, the work that goes in, the monitoring, the performance. I don't know how many times we talk about all these cases. People are all over social media sharing their stories, but there's no accountability. And I think at the end of the day, if there is accountability, then maybe there will be some justice. Because when people get away with it just being a mistake, and then everybody moves on. We're just waiting for another mistake to happen and then another mistake to happen. And we're talking about these things now. And you reminded me of a case where a set of twins was born to my friend's sister, and they needed oxygen. Again, from Ikeja to Surulere, going to Luth. They got to Luth, oxygen was finished for the first one. The first one died. Before we knew it, oxygen, 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 the second one died. A lady, first time child, first young couple, they lost their twin babies. And I was just, grieving at the same time that this happened. It wasn't even up to 4 months. So I know how the human cost of life in Nigeria may not be as valued as so many countries that look at life like a big deal, maybe because we're many, but we really need to ask ourselves the question, how we are handling the situation. Like the Honorable said, the rules and regulations are there. We all went to school in Nigeria. We know that Nigeria has one of the best education systems in the world. But the thing is applying this knowledge, applying the knowledge, and not having things happen whether you like it or not. Somebody ends up being a doctor because the system works for you if you have money, or the system works for you if you just stay long enough. At the end of the day, recent events have definitely shown why there's a lack of interconnectivity in Nigeria. I mean, we are evidence that Nigeria at some point liked the diversity and the unity that we had. Crossing the country to go do NYSC after you finish, people scattering across the country to go to unity schools. We know that the foundation of our country was based on making this unity and diversity work for us. And today we see how patriotic some countries are, like Canada. When Trump comes in and he wants to attack us, we're all united to protect ourselves. Nigerians need to understand that that power in our diversity is about making Nigeria work, is about making Nigeria one, so that we can work on our systems to work for everyone. Like we hear about how, yes, favoritism here and here. And like the Honorable said, if somebody is brought in, whether they like the job or not, but it's an opportunity to help you. And you're not even passionate about the job.
Yep.
You just got it because you know somebody who knows somebody who knows somebody. And then you're not even passionate or even equipped to do the job. You're not qualified to do the job. So we're failing ourselves over and over and over again. And until we get to a point where we realize our unity is our strength, our diversity is our strength, we need to focus on what works for all of us, our Nigeria will not work. And this is why we're here to share with our youth how we should think about the future. So from the perspective of our diaspora, the image that we want to hear, we want to see a Nigeria that is so welcoming, that is so proud of its diaspora experiences. We hear them celebrating us, but we wonder whether they listen to us, because we're bringing out all this, and so many of us have gone and invested back home. But when you see someone like Chinamada who has gone home to take advantage of the system and it's failed, how does that look to us? And how can we help people see better is why we're doing this. So I want to take time to give each one of you a last word on healthcare, so that we can maybe leave some thoughts, food for thought. So I'll start with you, Dr. Hawa.
Okay, thank you, Khadija. So, just food for thought for the healthcare in Nigeria is, first and foremost, we should be able to have accountability. The Who are the medical directors accountable to? Is it the Minister of Health? Is it the President? Is it somebody, whoever it is? Let there be accountability. It's also very important for them to know their doctors, know your staffs, which doctor is qualified for which procedure. So you know who to put on. It's not just because, oh, you have to be on duty today. No. Yes, you may be on duty, but there may be a specialist for certain kind of cases. So let them try as much as possible to put this system in place, and let our hospitals not just be a kind of structure, but let it be a system that works for the people.
Thank you. Thank you. Honorable.
Well, in my case, I would like to say my contribution is that the government should take a total audit of the healthcare sector, from the professionals and the unprofessional or the unregistered health professionals, because it beats my imagination, and that's one of the major problems that seemingly occurs. You go to the hospital, they say the person died because there was no oxygen. How can you even have a hospital, even a clinic, and you don't even have one tin of oxygen to survive somebody? So I think, in summary of all these things, is the Ministry of Health should take a proper audit of the healthcare service providers.
Thank you. I really definitely agree with all of you. I feel it's a very simple case of the system has to be in place that everybody must follow. Like you said, auditing, we know that we have different types of systems happening in Nigeria. And this is why there's no accountability, because this person is doing his own this way, this person is doing his own this way. I think knowing what has worked abroad, knowing what has worked, people have worked in the UK for many years from Nigeria. They know that there's a system. It's a very simple system. You come to North America, it's the same system. You go to the US, it's the same system. So why can't we have that same system? We do have the system, as the Honorable said, on paper. We just need to follow the procedures that we have. But I think it's true to say the federal government has to have a unified system that everyone must abide by, so that when even audits happen, it's checked against the standard system. And I think that's what we need. To the youth of our country, as you listen to the chaos in our system, we need you to identify what's right and what's wrong. Because sooner or later, you are the leader of tomorrow, and you're going to find your way into making these systems work for us. So I want to thank you both for joining me tonight on this episode of Healthcare in Nigeria. We talked about it from the perspective of our outcomes and our failures in our system and what really makes hospitals function. So thank you again, and we see you next time. Stay tuned for our next episode. Have a wonderful evening, guys.
Okay.
Thank you
Bye.
very much.